Okay, we are good to go. It's 1:30. Let's rock.
Okay.
We have introductions, and I think everybody here is well acquainted
And
with
I think that
everybody.
we pretty
So
much know who we
We
are,
can
right?
we can
Okay.
get going, but
Okay.
the April minutes.
Yes.
Do you guys have any additions, corrections? No. Okay.
Great. Awesome. Okay. So why don't we move right into Cody? And if I know I've got, start with the simple first, maybe.
Yeah, great. Simple first. So first thing kind of regarding the frequently asked questions that came up last meeting. Regarding the frequently asked questions brought up in the last meeting, I am working with a gentleman from Delta who's in my same position for Delta County, because they're also a very small program, sort of frequently inundated with different questions of a wide variety all the time. And so we are working together. We've put together a few pages of frequently asked questions at this point, primarily relating to on-site wastewater and then food, which are probably my two primary programs. And then I have given copies of those to Christina, who's our front desk, so she's been able to field a lot of those questions better. And now we're kind of getting into more nuanced issues of waste and a couple other things. Basically, there's, sometimes it's a really simple question, but a really complicated answer. So we're working through some of that, but I just wanted to update you all that has been working out very well. And at this point, it is saving a lot of time. Next piece, I just wanted to follow up since the septic inspection on the property on Road 21, if you all have, if that is, how is kind of that looking?
Where are we at in the process?
Yeah, or I guess kind of just if there was a process, I know.
There is a process.
Okay,
So
cool.
after your inspection, what has been, that said you had no other issues other than you had a little bit of water leaking outside of one of the RVs there. And it was
Correct.
capped, and you were good to go. That now takes you out of the picture. However, he is not compliant with anything in the planning as far as having an RV park there.
Gotcha.
So he now, if he's going to have an RV park there, has to go through the planning process, and then it could go back to you because then he's going to have an
Gotcha.
OWTS, and then that process begins, but it gets it cleaned up.
Excellent.
But before we had the inspection, we didn't know if he was compliant or not compliant with that portion of it. Now
Gotcha.
we know that he obviously is, so we move into the planning section of it.
Cool. Thank you. Next piece, kind of on the topic of OWTS. So, kind of last I heard, there was a moratorium on the transfer of title program, and in regards to that program, basically I've received, many different questions, both from realtors and property owners about it, and honestly, rather we keep it or not, I don't really care. It's just that currently it is on the books in Montezuma County as having a transfer of title program, and it's not something that I have, it's not something I'm participating in or enforcing or anything like that. But if that's not something that the county, wants to do, I would just prefer it to be official. That way, I can.
Yes. And
needs to make a decision on that, whether or not you want to have that program in place or not.
Yeah, exactly.
So it was an opt-in, opt-out program, if I remember correctly. And it was opted in prior to my arriving here 2.5 years ago, so you guys probably have no idea what we're even talking about. So this is under Regulation 43
yes,
or 41?
43.
43. It's an opt-in, opt-out program of prior to a transfer of title, so at the sale of a property, that you have to go through an inspection which states that the OWTS is functioning properly, or it is not. The issue that I have with it is if it's Dr. Aiken and his wife on that piece of property and the guy, you buy it and you've got 10 kids, it could not be functioning property for that. So, how many counties now, the last time I looked, there were 16 counties out of 64 in Colorado that had anything to do with it. How many are there now?
I know there are a few more. I don't know an exact number. I know that primarily a lot of folks, La Plata County has it. A lot of folks basically working the area, contractors and stuff, they're familiar with that process, which is one of the reasons they ask. But I have no idea how many total.
And if I recall correctly, so it was opted in for Montezuma County, and then we put a moratorium on it. Right. But there had to be public notice when we opted in, and so now that the moratorium has expired and has been expired, it needs to be addressed, and if we're not going to do it, that's fine, but what happens is the state has us listed as having it, and we get realtors that are very upset because we say we have it, but we really aren't using it. So it puts us, public health, in a bad spot. So if we're not going to have it, then I do believe it has to go to public comment again in order to say, no, we are not going to do it. We're opting out.
30 days notice and rescind it if you guys want to. We can extend the moratorium if you guys want to. You guys can direct the health department to start enforcing it. Essentially, I don't remember. I haven't looked at it in a long time. So correct me, because I feel like I'm probably not going to give accurate facts here, but I think it was if your septic system was more than 20 years old, and if you were going to sell a property, transfer a property, then it needed to be inspected. Was that when it was applicable?
I think it was 20 years.
That is ringing a bell, but I would not want to be quoted as saying that without, because I can't remember exactly, but I think it was 20.
So it doesn't affect every transfer.
Correct.
But it does affect transfers where the septic system is over 20 years old.
Right.
Yeah, and
Right.
that's in line with what's called an NAWT inspection, which is basically like an after the system's been around for a while and functioning. Basically, that is the inspection that would be required, and those requirements do meet. That's kind of what's required for that type of inspection, which it kind of makes it an easier process. But yeah, I don't know exactly. It's not something that I've.
So at this point, it's basically unfinished business. If the moratorium is still the stand of the commission, then it probably, yes, it needs to be decided we're not doing this then, so that there is not misinformation out there to the public and to realtors and to everybody that we're doing something that we're not doing.
Yeah, and it primarily for me is just getting to the point where I'm talking to realtors, property owners, lawyers, and other folks, and trying to explain the current situation when, it's just, basically unfinished.
I think at a minimum, at the next POCC meeting, two of you vote to extend the moratorium if that's what you want to, indefinitely. You're only supposed to do it for up to 6 months, but, or if you all want them to start enforcing it, that's all you gotta do is say start enforcing it.
So why are the realtors calling you then? Because all the realtors were in here when we had this discussion last time, and we put the moratorium on, and
So
I don't know if all of them were here, but
yeah, I mean,
yeah, it was split. I mean, realtors had
they're
split.
pretty much putting it in their contracts right now that, well, I shouldn't say everybody, but
Yeah. And I just think, even, like I said, even from the state's perspective, when they're talking to people about it, it does. It looks like Montezuma County has this transfer of title in place. And then they call us and we're like,
So, one of the arguments
there's a moratorium.
was that it might cost another $200 or something for somebody to do the inspection, because I think with one of the prior commissioners, why they objected to it, it probably cost them $300 to do an inspection.
It'll be more than that.
Okay.
I think usually it's about $200 from what I've heard from NAWT inspectors. which I am not. And then I'm not sure exactly what Melissa proposed or what it was initially, but then there's like a small fee, like $25 or $20 or something like that. And once again, it's not something I've ever practiced. It's just something that I've heard about and that Melissa kind of keyed me in on. And that would be a fee for the county basically to transfer the title. Because currently I do that a lot. We just don't have an established program for it. Because basically every new property owner wants a copy of the previous septic system. And that's either the property owner or the realtor or something like that. And so I do spend a lot of time transferring those permits. It's just that the permits are almost kind of just paper at this point because we don't know what the status of the system is 20 years later.
Which, correct, but you don't know what the status is if it's inspected today, what it's going to be tomorrow. It just says
Right.
it's functioning properly today,
Right.
but when
Correct.
Joel's 20 kids move in, it's not going to be functioning properly. That
Well,
was
yeah,
the issue that I
absolutely.
had with it. It doesn't guarantee, the way it was set up, it was supposed to be a guarantee that, yes, it's functioning. Well, yes, today it is. Like I said, Kent and his wife are there and
And-
functions
and so then-
great because it was designed for a 3-bedroom house with X
And
20
and
years
so-
ago, but today it doesn't.
I mean, you're absolutely right. That's kind of one of the issues that we have, additionally is because, so one thing that transfers with the permit is the engineering. And each system is only engineered to accommodate a certain number of bedrooms, which in the code, accommodates a certain number of people. And so the system is only deemed like effective given those parameters. But once again, that's, you have to kind of understand septics in order to understand that that's implied. And definitely there are people that move into properties with a functioning septic system with a huge family, and then it, is
It fails.
distressed in 3 weeks.
That was the real issue that I had with it, and the other issue I had was, how do you inspect it when you're just looking at a tank and not the entire field?
And that's why it needs to be NAWT. There's only a couple in the area, and they do a couple different things, but even given an NAWT inspection is really the best guess that we have on the functionality of the
Correct,
system.
and I hate
Yeah.
regulating a guess.
Yeah.
That, to me, that just doesn't
And I think
make
part
sense.
of what happened too historically was, because I was with Melissa when she met with engineers and talked about the NAWT, and they paid a hefty sum to go to the training that was held in Durango. And they paid that sum with the intention of, this would be an additional source of income when they were required to go do those inspections for the transfer of title. So it was kind of it was all happening simultaneously, and so that was another factor that was involved with, moving forward with it, because those folks did what we asked them to do when we said we were going to adopt the transfer of title, and then we're not. So that was part of the other piece of the conversation. But again, it is the BOCC's decision of what you want to do with this, and we're just asking that
We make
public
the
health
decision
know,
one way or another.
yes, so that
So-
we know what we should be telling people. So,
And if we don't want it on the books, just get it off the books.
Yeah.
For
You can rescind
liability.
it with
Yeah.
30 days' notice, then you have your hearing, and you listen to people, and you can rescind it if you want to. You can just say the word, two of you, to say, okay, we're gonna start enforcing it, no more moratorium, or you all can leave it in a moratorium stage, because it is, but you should take an action to do that. It is on the books now formally, but not being enforced because it's in a moratorium stage.
but that moratorium had a deadline, which we've passed. So that's,
Gotcha.
so, yeah.
And it was a 30-day moratorium 2 years ago. So
It got changed to a 6-month.
No, it was changed to
I think we
either way,
extended
it's
it,
2 years expired.
but we never addressed this in 2020 for many reasons. But, so,
Here's the issue that I have with it, and here again, it's just one more regulation, that's a guess. And I hate that, because you cannot I'd rather educate somebody that's purchasing the property to what you need to do properly. Instead, we regulate it, and what do we solve by regulating it? We've done nothing. I mean, really, what have we solved to regulate it?
I mean, essentially, yeah, I mean, you know, I'm not
So-
for or against it, I really don't have a
Right.
dog in this fight. It's not something that I've enforced up to this point, and so I don't know what mechanism we necessarily have to go through with that. I know that it's not, you know, if folks, property owners, new property owners call me, I'm always more than happy to talk to them about their septic system, you know, shoulds and shouldn'ts and you know, all that sort of stuff. It's, you know, I'm not an NAWT inspector. We do already require those inspections to like receive an after the fact permit if a property, you know, was put in the early 70s or prior to that. And a person's like, well, it's still functioning fine. It's not something I can permit, you know, after the fact until it has been, you know, NAWT certified. And so that, you know, it's an established process in kind of the OWTS world. That being said, I don't have that credential. I don't know what goes
And I
into
think
that.
that's why they left it as opt-in, opt-out.
So what
And-
is the education process now? I mean, a lot of people, they buy a home,
Yeah.
your lender may require you to do that inspection if you meet a certain level. But if not, then who's educating people on the fact that this was built for, 5 people and you're moving 10 people in? By
Basic-
chance, they just maybe call you.
Yeah, exactly.
But if
Basically,
they
it
were
would be-
to be NAW, if this was a
inspector.
requirement, then they would be educated.
Yeah, so the NAWT inspector would do some education, and they would have to have a copy of their permit with the engineering that includes that information. Because otherwise, yeah, I mean, you know, transactions happen, you know, hundreds of times a week that I don't know about.
Right.
And I don't really want to be able,
But
you know, not-
Yeah.
No.
whoever is making the sale, they don't really have that right to make that, to ask that question. How many people are you gonna move in here?
Right.
Yeah, you can't.
You can't.
Yeah, but when you're the
That's
one
true.
paying for that, when you're the person who's buying the home and you have to pay for that inspection, you get that information. You're being educated then. I'm just throwing it out there. So, nobody else is really doing that unless they're calling you and saying,
Yep.
what does this septic look like?
And most, I
know.
mean,
Like, we need to put it on our next board meeting and.
And what
We
is
can-
home, they require a home inspection anyway. Are those home inspectors looking
They
at
don't
the
do
septic?
They're not
Mm-mm.
looking at septic system.
That's a whole separate.
yeah.
Totally
and-
different thing.
Yeah, certainly, you know, certainly pros and cons. It's, you know, you're right, it's more regulation. And frankly, a lot of folks that I work with recently, a lot of folks either from like urban areas, rather it's, you know, Phoenix or Denver or someplace in California, a lot of folks don't even know that they are even on a septic system or kind of what a septic system even is. Yeah,
Yep.
seriously, they just think that their kind of waste sort of magically evaporates. I'm like,
Well, it does for a while.
yeah, exactly.
Yeah, for 10 days.
Yeah. So,
I'm getting comments that all of you are very difficult to hear.
That's personal.
Sorry, my mic was off. I'm getting comments that all of you are very difficult to hear.
Meeting rooms open.
Okay, Shak, put it on our agenda for the 2019? That sound correct?
The 19th
I'm
is a
sorry.
workshop.
I'm sorry.
20th.
20th.
Yeah, we probably should bring these guys up to speed at a workshop before we make a decision, because, I mean, there was a lot to go over when I first stepped into this position.
That's what I was wondering if, because Commissioner Stevenson and Commissioner Lindsay, you weren't part of that previous, and, it might be a little bit of the uneducated educating the uneducated, I don't know, but we could do our best to kind of bring up to speed on what that document says, like in summary, because it's multiple pages.
and it's something I'll
so-
certainly have to look over, because I don't know what fees were in there or what was required. It's, like I said, it's something I've never even looked at
But
it.
we could make sure you have, like, send an electronic copy of that transfer of title so you guys can look at it.
And it is, and it's all been,
Monday on our workshop.
Oh, okay. Okay.
yeah, you could do it then.
Yeah.
Because I was, it had been voted on and they were going to implement it prior to me stepping into the commission.
Mhm.
And shortly thereafter, it was
There was a change
a
of decision
change.
basically by the BOCC.
Mm-hmm.
Wind direction changed, and they said, well, we already made it law, we'll just put moratorium on it, it's the easiest thing to do, we don't want it.
So, yeah, if that works for you guys and you want to do it, and then we can make a decision on the 20th.
Okay.
and
So
then that way
you,
have a direction.
I'm assuming you want us here for Monday's work group,
I would think
Yeah.
so because
Okay.
they're going to have questions
and we'll get
that
you
nobody
electronic
else-
copies before then.
You don't have to have
Um,
everybody here, but
Okay. Okay.
And I'll do my best and brush up on it.
Mm-hmm.
I
Cody,
know.
why don't you call, did you say LaPlata has it?
Mhm.
Call that girl or guy.
Okay, yeah, okay.
Maybe you and, like,
I actually would, they definitely are pro. They've been trying to get me to jump on a transfer title wagon for a while, so if you,
yeah, they can try to market.
yeah,
it to you
exactly,
guys.
maybe.
But theirs is totally different. Most of them on
Yeah.
Plata County are lagoons. You can go out and inspect a lagoon. Here, they're all buried. You can't do it. You can inspect the tank. And that's really as far as they basically go. I mean, there are certain points down the road that they can inspect, but
Yeah, I know they like use a rod or something to, like, they try to stick it in a leach field that has plastic infiltrators and, but, like I said, yeah, I don't
Okay.
familiar with that.
it'll be
Okay.
on it'll be on their workshop because and it's all online too.
Yeah.
You can look at it under Regulation
Mhm.
43 on CDPHE's website.
It's completely up to you guys, on if you want this in
Mhm.
place or not.
Mhm.
The state of Colorado has decided the counties can opt in or not have it. So we opted in, put moratorium on it.
Well, like, I don't think there's any sense charging somebody for something that we can't do. That's,
Yeah, I
If
mean,
it was something better than a guess.
yeah.
I mean.
well, and once again, I'm not an inspector. They may have supersonic, sophisticated ways to do that. It's just not ways that I'm familiar with. So I don't really want to speak for them. And, I bet if even me calling it a guess is probably not appropriate. So I'm going to rescind that and we can call
You're
LePew
gonna
or
put a
something.
moratorium on it?
Yeah, there we go.
Gotcha. Okay, next, what else you got, Cody? Let's go
Alright.
with the easy stuff first.
Yeah, right, okay. Well, last piece for me anyway. So recently, summer, everything's opening up. I have received notifications and also complaints about food operators that are not licensed and operating. For example, I have a current situation from the Celtic Festival where a woman who I was working with to become licensed, did not receive the license. She didn't complete the process, and then she was selling hamburgers at the Celtic Festival, and then I've received complaints, from the operator, kind of manager of the Celtic Festival, about undercooked food, undercooked hamburger, which is a pretty big foodborne risk. And so then I issued a cease and desist order for that regard, and then I might just need to touch base with Baxter and kind of see what that avenue is, because we want to make sure that folks that are selling food are licensed appropriately, to prevent any sort of foodborne illness. And I know I can't be everywhere all the time. I was inspecting like Dunton Hot Springs that weekend, and so I wasn't even able to be at the festival to see who was operating and not operating. And I did go over with the operator to make sure that they understand and are able to recognize what license they need folks to have. That way they don't inadvertently let somebody that is not licensed operate. And so it's, kind of education on both sides. And at this point, I believe that a cease and desist order is sufficient, and I will work with the you know, with that individual. You know, but if, you know, for folks that are, either if this individual continues to operate or as other, you know, as I hear about other situations, you know, last year I was kind of spared because nobody was operating, and now everybody's very gung-ho about operating, and it takes time. There's, you know, there are hurdles to jump through. Basically, it is a state procedure. If you're licensed to sell food in Montezuma County, you're licensed to sell food elsewhere in the state, so it really is a, you know, very strict state protocol. And you know, I just want to make sure that let you all know about the situation, and then for this situation specifically, just make you all aware if we end up needing Board of Health input for legal action.
Okay.
And we just learned about this
Yeah, that
this
happened
morning.
Yeah,
Was there a
So-
food handler certificate in place?
not that I'm aware of. And, you know, so there are a couple different certificates. There's like a food handler's card, and there's even like a food manager certificate. But, you know, those do not license somebody to
Right.
sell food. It's basically just means that they have the knowledge, which if they did indeed have the knowledge, then I wouldn't have I would not expect to receive complaints about undercooked food as well. And so it's kind of two sides to that. Not only were they not licensed, but then the food is also potentially hazardous. And so,
How do you verify that complaint?
so I mean, basically, at this rate, so I talked to the person at the event who, you know, basically confirmed that this person was indeed there and was operating, but as to like whether or not the hamburger was undercooked, you know, I don't. And so for me, it's mostly the fact that they're not licensed and I am receiving complaints. Because if it does result, you know, if there ends up being like any sort of foodborne illness outbreak, you know, or something like that, then, you know, then that kind of gets kicked above my
They
pay
just need
grade.
to finish their
Yep,
license.
yep, and then ensure that they're not doing any other food operation until that, you know, and, you know, and it takes time and there are hurdles to jump through. But for this individual, you know, I've been working with them at least since March. That's as far as my emails go back, but I know I've been working with them, you know, prior to that. And, you know, folks really don't want to fill out documentation, which without the documentation, I don't know the extent of the operation. I don't know if they're going to meet like the minimum criteria. And so paperwork is important.
Okay.
And
Sounds like you got
they're
it
supposed to post that license, correct?
Correct, yeah, and so I guess just for your all's knowledge and folks listening, you know, all retail food providers, they do need to have their license on display. You shouldn't need to ask for it. It should be visible from basically the ordering window. There are a couple of minor operations where I have discretion on who isn't licensed. Primarily, the only ones we have in this county so far are cottage food acts, which are, you know, primarily baked goods, jams, jellies, pickles, that sort of stuff. Those folks do not need to be licensed. They just have to follow the Cottage Food Act, which kind of determines they do need a food handler's card, and they can only do certain food products, primarily excluding all like proteins, no beef, chicken, dairy, eggs, that sort of stuff. And then the other part are some like icy vendors, or, you know, they make like the snow cones. There are certain things that if folks want to do, they do need to be licensed. But if they're only doing flavored ice, you know, there are a lot of them, and the food risk is potentially low, and so I'm not licensing those folks unless they're using toppings or dairy products to make like certain, like a Hawaiian variety of shaved ice. And so, you know, and even those folks, you know, they still need to touch base, and so, yeah.
And so we just
Very
mainly
good.
wanted to update you in case you hear anything further, so.
And this is a perfect opportunity because we had a meeting this
Yeah,
afternoon.
we were talking about it, I'm like, let's bring that to the Board of Health today.
Well,
So,
it sounds like you have it under control. You have the cease and desist, and
Yep.
you'll work with that person to move them forward through the process. Is basically all you can do to educate them and get that completed. Okay.
And then that was all I had.
I have a slightly off-the-wall question, Cody, since we do have the journal in here for the first time, and a long, long time.
Oh,
Good to
he's
see you,
been here.
Jim.
Yeah, you've been here.
He just hasn't been here in person.
Well, he's been on YouTube, but I haven't had the opportunity to bask in the glow of his radiating smile for quite some time. So, but I'm not seeing in the journal the restaurant reviews that used to be in there. So I was just curious where we're at on restaurant inspections and where we are on the articles about them.
Good question. So I am doing restaurant inspections. I've primarily been doing mostly restaurant inspections the past couple weeks. And so, we're finally getting caught up. Basically, I was told by the state, so beginning in like January 1st, I believe it was 2020, there is a change to the, basically the way that health reports are made for restaurants. And according to my people at the state, they said it is not, like, it's basically information for the operator, but it wouldn't necessarily be, like, you can have what would look like a really bad violation on the form, but it would technically not be that important because the food code, which we use in the state of Colorado, is very complicated, and there are numerous pieces to each thing. Whereas on the form, unless you see like a hidden score, which is not public in the state of Colorado, in other states it is, that score is not public in Colorado. And so it's basically a way for me to work with the operator. And I have a couple mechanisms. So basically, if you are between, 0 is a perfect score. And then if you are between 0 and 49 points, then that is considered a good health inspection. Obviously, there are things that you can work on, but it's not considered like an imminent health hazard. Now, if you're between 50 points and I believe it's 110 points, then in that case, it triggers a re-inspection where I'm required to re-inspect those folks within the next few weeks to make sure that they tightened up, different things that we talked about. And then for individuals that score above 110 points, then I shut those folks down basically as soon as I have that score calculated.
How many points does each violation carry, or does it depend on the type of violation?
It depends on the type of the violation and the severity of the violation. And so that's one of the reasons that the state doesn't really want that so it is public record, but I was told basically if you want a health inspection record to have them go through like the state channel in order to get a copy of that. Yeah. And so since I heard that, at the time really I wasn't doing any inspections. I was doing a couple, but not like I should. And so since then I haven't sent reports, and they changed databases and a couple other pieces. So complicated answered, simple question.
They have to be over 110 to be in trouble.
I guess my follow-up question about how many points per violation, I was hoping it wasn't a 1-for-1 ratio.
Yeah, well,
I was hoping that if they had 50 violations, maybe there'd be.
yeah, 50 violations. I think it's out of, like, the critical violations are out of, I think, like 29. So if you had 50, yeah, you'd definitely, you'd definitely. I mean, it is nice. This was a change that, up to that date, I believe it was January of 2020, there wasn't a lot of recourse. Like, basically, you just write a terrible inspection, and there wasn't any way to hold those folks accountable. And for that reason, Melissa was very encouraged to put it in the newspaper to create some sort of accountability for folks. And with like the new mechanisms, since we do have the capacity to like shut folks down that need it. I mean, if you're at 110 points, that's pretty. I mean, that's.
You're not supposed to do that?
You're in trouble.
But it's been
And so, yeah, among other, and so and really, I think folks, at this point, folks need a lot of more education. It's been kind of a really odd year, and things have changed, and especially now for a lot of retail food folks, they're having a very hard time finding employees, and that obviously makes the whole operation more complicated.
So the summary basically would be, given the system that you have in place now that the state's put in, that you use to inspect, it's not necessarily needed for the public to have that information because there's more to the story, right? Than pass or fail,
Yeah, and
essentially.
to look at that report, it really would not, the information really would not be accurate. Like, it would just
Right.
be a report. It wouldn't necessarily be indicative of how well that facility is operating. Yeah, and so,
Does that answer your question? Shak?
Yes.
Okay. 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 So, moving on, anybody have any more questions for Cody and environmental health? Good? Okay. All right. So, Shak, I had you down here to kind of fill us in on the community intervention program. We are kind of on the fringe. I think we're going to be coming to the next meeting on that, but if you can kind of update us on, or did you do that today?
I did not do
Okay.
that today, but
Okay.
I will give those who aren't in the know a brief rundown. After the passing of Senate Bill 217, law enforcement is generally not supposed to make contact with somebody unless there's believed to be an infraction of the law. And certainly if they do, they have no authority in a situation unless there's an infraction of the law. And obviously certain law enforcement agencies have concerns about their liability and issues of that nature. So our local law enforcement, including the chief of police and the Mancus marshal, had initiated an attempt to deal with some of the things that aren't necessarily criminal in nature that currently they respond to or have been responding to, and the way in which law enforcement handles those responses may not be the most effective way. And so what the law enforcement is asking for is a new team that would involve an EMT and a clinician to go out and respond to those types of calls. And I can give you such as with what those calls look like, but from our dispatch numbers countywide, we can see a large increase, and let me switch the screen so people on YouTube can see too. But so our attempted suicides have gone up from 40 and 30 a year to now we're seeing 60 last year. Our overdoses, again, almost doubled. Lots of welfare checks that are not necessarily criminal in nature. Those are also increasing. Mental subjects are staying about average, and but these types of calls, that often what happens in these types of calls is that either police respond and nobody's done anything criminal, so nobody's going to jail, or EMS responds and nothing's broken, nothing's bleeding, so nobody's going to the hospital. And these people aren't getting the help that they need when they are taken to jail. It's oftentimes that they end up in a circular cycle where they're released and now they're on some kind of parole and they have some minor violation where they're drinking or something like that, and it starts a cycle of them being in and out of jail, in and out of jail. It's not an effective way of dealing with the issue, or oftentimes if somebody's hospitalized without their without something being bleeding or broken, maybe they get an M1 or an M3 or 72-hour hold of some sort, and then nobody pays for those bills. And so the hope is by putting together an EMT clinician team that there can be a better response to situations like that. And the chief of police, Mancus Marshall, sheriff, and Axis will be doing and Cortez Fire Protection District will be doing a briefing at an upcoming commissioner meeting. They're still doing research and in response to revenue declines from Kinder Morgan and from property taxes. That's a large part of the research that they're doing, but that's a brief overview of the program. A lot of the times when there's a response to one of the types of situations we just discussed, the responding agency calls the Access Crisis Hotline, and that team has a 2-hour window to respond, which a lot of people feel may be inadequate. This would provide clinician response immediately on call for the whole county, so there wouldn't be that 2-hour time frame. It would be dispatched through the dispatch center, and it would have a
But
response.
the proposal is only for 10 hours a day.
Correct.
So they still may have to revert to the 2
During a pilot period, yeah. And then
Yeah.
if it was able to go longer, maybe 24-hour coverage. And so part of that equation would be getting with dispatch and finding out when those peak hours are and that type of deal. So like I said, they're still doing research. All the questions have not been answered, and there's going to be an upcoming presentation. Of course, the long and short of it is looking for ways to fund it. The only entity that apparently has authority to respond countywide is the county itself, and that's why it keeps coming before the county. And so that'll be a big part of it. It was asked during the meeting with Phil Weiser on Saturday about funding for that. He did say that is one use that funding could be used for. I think it's important to realize, and I'll spend a little more time on the Attorney General's meeting, it's important to realize that this would be a countywide program. Everything coming out of the opioid settlement is going to be a region-wide deal. And so the crisis intervention team already provides region-wide response. And that's part of the reason for the 2-hour response time, is because they respond to La Plata, San Juan, Archuleta, San Miguel, Dolores, and this would be something that would respond to all of Montezuma County, but not beyond the borders of Montezuma County. And so that's an important distinction to make there. A lot of questions came up at the AG's meeting on Saturday about funding all kinds of things. I think almost everybody here was included on the calendar invite and has a copy of the IGA that's in front of us. But this intergovernmental agreement basically needs to be signed off on by by all counties within the state and by virtually all municipalities in the state to reach their goals. The reason for that is if we get the IGA signed off on by everybody, it effectively doubles the amount of money coming from these opioid settlements. If there's holdovers, then we only get half as much of the money. And so that's the reason for that being, and if needed, John can allude to that, to the answer better. But my understanding of the reason for that is so that none of these municipalities or counties can then go back to Johnson & Johnson or Purdue or whatever and start their own lawsuit against them individually. Does that sound right, John? And the answer was yes, because he didn't have a microphone. So the state needs everybody to sign off on the agreement. Within Montezuma County, I have already spoken with all of our municipalities. All of our municipalities are on board. All of you have seen the IGA the sheriff's seen the IGA. Most of you have responded in the affirmative, and none of you have responded in the negative to the way the IGA is currently written. There's been a many meetings between CCI, CML, and the Attorney General's office to try and address everybody's concerns. And I think most of the concerns have been addressed. I know the Attorney General was in our county, obviously, on Saturday. He also had a meeting in Durango earlier Saturday morning, and then a follow-up with La Plata County on Sunday mid-morning, and then another meeting in Archuleta County on Sunday. So he was a workaholic over the whole weekend, trying to make sure that these things are shored up. One thing that is going to need to be considered fairly soon is we've got to put together our regional board, and that involves the county sending a delegate, public health sending a delegate, social services sending a delegate, and law enforcement sending a delegate, and then the municipalities will send revolving delegates. I think you've all seen that as you've read through the IGA, but we need to be in consideration about who we will be sending, both public health wise and for county wise, as our delegation to that. It can be a commissioner, it doesn't have to be a commissioner, but those are things that we're going to need to be considering fairly soon. As far as the money goes, our region, let me see if I can pull up the worksheet.
Shak, did
No,
you
that's not
understand them to say, the Attorney General said, so there's 19 districts.
Correct, statewide.
And so everyone has to sign on before anything, before you can move forward. Before any money is dispersed, everybody has to be on the same page in order to move forward. Did you hear that?
Everybody has
Yeah.
to sign on in order to double the money
For the funding, full funding.
For full funding,
for
okay.
full funding.
So it would be half that funding if you didn't get every
Correct.
19 district to
Well, it's
sign
not
on.
the 19 districts that have to sign on. It's 64 counties and however many municipalities.
Right.
And so is that a large undertaking? I think it is a very large undertaking, but I think the AG's office, CCI, and CML have worked together very well to
And
put together an IGA that is likely going to work for everybody.
Did you understand the dollar amount to
I
be
did.
150,000?
Well, and so I'll try to pull up that spreadsheet.
Because if that's got to serve, that's really seed money, is what this is, correct?
I think it's even,
I thought
it
it
is.
was 369 for the region.
So I'm gonna,
But then the
pull-
5 counties, each count, so it basically breaks down to,
Which is not too much.
We figured $19,000 a year for Montezuma County
Yeah.
for 19
Mhm.
years.
I'll bring that up. Give me just
Seed money.
1 second.
Actually, I thought, no, I think it was 22,000.
Could have been.
So I'm bringing that spreadsheet up now. I will zoom in on it. And Jim, I can send this to you later if you want. Okay, so so the southwest corner, our region, this is the breakdown by the county governments or by the local governments. And so you can see all of them combined comes to 1.6 with our individual disbursements. Montezuma County's portion of that is $403,075.74 if we get the full allocation, distributed over 18 years. So that comes out to roughly $22,000 a year. So, and then when you look at the regional,
So is it really even seed money? Is the
well,
question I keep
there's
asking
a portion for the regions too,
which is
and
our 5-county.
which is the 5-county area. And let me find that. South Central, West.
I guess that's where the board would come in to, because if you
The
basically have
board would have
22,000.
fiduciary oversight, that's correct.
Mhm. I
And
mean,
so the southwest
focus on
corner
one
region,
thing.
which again is our Region 5 area, would get the additional 1.8. So the total is just over 3.2 million spread out over 18 years. That includes all the direct allocations as well as the amount to the region. Now, if everybody doesn't sign on to the IGA, it's half of that. So obviously it behooves everybody to sign on to the IGA. It is not a tremendous amount of money, and there is a tremendous amount of need. And so one thing I've discussed with our municipalities, and I've discussed with La Plata County and with Dolores County, is the ability to pool all of our funding to give us that entire 3 million, and then to use that to go after matching grants and that, so we can maybe leverage it into something useful. I would even propose to the board, who can't make a decision and therefore doesn't need to answer today, that we'd be willing to, that we ask everybody to ante theirs up front, again, ours being 400,000, so we have it all up front to go after something, knowing that we're going to be a guaranteed court-ordered payback over the 18 years. So it's something to consider. And that would give us 3.1 cash in hand to go after matching grants. I will say the entire project put together is $57 million, and then at each level from there down, there's 15% taken out for attorney fees. So the attorneys are coming out pretty good in all of this. I'm not sure what's that? 15% of 57 million is low.
Yeah, usually they get 30%, don't they?
Well, I'll tell you what, for 15% of 57 million, I'll never tell another joke to this commission again. 7.5 million. All you guys have to do is vote on it and decide.
Paid out on how many years?
60.
Done.
Okay.
And so that's kind of the funding and or lack of that we're looking at. And I know we say it's not much, but it's 100,000 a year more than we've had to deal with the problem. So it is a massive problem, and it doesn't show any signs of getting better. So any questions or comments? Okay.
Thank you,
Mr. Baxter, I noticed that you've put in your notice you're not receiving 15% of this. No, for those of you on YouTube, Mr. Baxter is not receiving any 15% of this, although he would probably like to. No, nobody did ask. Nobody on YouTube can hear you because you don't have a mic. just making sure that nobody says, oh, that county attorney helped with that. And no, he's not getting 15 million. So I would also ask the commissioners to review the IGA. And if you do have any comments on it, you need to get it back ASAP. But I think most of you have, and I have not received any negative feedback at this point from the commission or the sheriff.
Okay, thank you, Shak. Okay, so now we'll move on to just a few things, and I don't have a whole lot necessarily from our department, and Laurel, you might think of something that I don't have written down here, so just pipe up. So as far as what we're doing, you know, obviously vaccine is still where we're doing a lot of our prevention and education and holding clinics. Currently, looking at the state website, I just got this number off this morning. Our county is sitting at 50.1% of folks who have gotten at least one of their COVID vaccines. And for fully vaccinated, it's 46.3 for Montezuma County. They are still working on a lot of, it's all guidance in regards to supporting schools. The governor and the school CDE, everybody is very much wanting kids in schools this year. So everything is being done, modeled around that, so that kids can get their education and people can go back to work. So, so that is definitely in the works. There's a lot of committees working on that guidance. There's been some preliminary drafts released, but nothing's final yet. So, we're continuing to do ongoing clinics at the health department. We have one this Friday at Wild Edge. If you are 21 or older, after you get your vaccine, you can get a free beer. And if you are less than 21, we will give you a ice cream card. So that is going on this Friday. And we're just doing what we can to try to encourage folks to get vaccinated. And we are, unfortunately, we've had 2 nurses on board with us to help us cover the weekends and holidays because we've been working 7 days a week. And one of those nurses is no longer going to be doing that for us, but she is helping us with our clinics. And our other nurse will be retiring from us after Labor Day weekend. So we are advertising for 2 nurses. We would love to bring 2 people on to help cover what needs to be done on holidays and weekends. So, I know. So, but you know, you can work remotely. It's actually not a bad gig. So, I hope that we are fortunate enough, because otherwise, all of us who have been doing this are going to go back in that saddle again. So, which we don't want to do. Okay, we are still trying to hire a full-time WIC immunization nurse, but that is currently our only full-time staffing position that's open right now. We are basically fully staffed with the exception of that role. So we are advertising for that. And by the end of this year, I don't know exactly what date it will be yet, but Dr. Aiken will be retiring, and he will be leaving his role with us as the medical director. So we've reined him in before, but I don't know. It's been a long year, year and a half now, right? Huh. So so we're in the process of talking to another physician, and so once we consolidate that, we will be bringing that decision to the BOCC/Board of Health for a final approval of the appointment of our new medical director. So we're working on that. Let's see, what else do I want to share from public health perspective? You've learned a lot about what Cody does and the whole restaurant piece too, so appreciate your support on that. So I think that that's really all I have from the health department. Do you have anything, Laurel, that you think is pertinent? Do you guys have any questions?
I'm still trying to recover from 4th of July.
What happened over the 4th of July? Dehydrated, too much sun.
See, all those
I
days
wrote-
off
I
of
wrote
not
my-
being at work just get you tired.
Spend too much time
I
building.
really want that to happen to me. I really do.
You spent the whole weekend building a shop, huh?
This weekend.
Oh,
Yeah, no, I rode my dirt bike a little too long this weekend a few times, so.
You're not crippled up either, are you?
Just a little.
Mine is just a little.
He's a little, she's a little, he's a little.
I know. We should have relaxed.
Does anybody have any questions
I
about
don't have
any of
any
the
questions.
programs we have going on, the health department?
And
Just come in next Monday and fill us in on what.
Yeah.
Transfer of title.
Next meeting, we can
Mm-hmm,
vote on it,
yeah.
clarify things for Cody here.
Mhm.
I appreciate it.
and it's an opt-in, opt-out at any time, the way I understand it, correct, John? Whether it's applicable now, Regulation 43, that title of transfer,
I think
it
so.
can happen at any time.
Right.
If things change here, I mean, it can happen at any time.
Right.
You can just email us some of that stuff so we
Mhm.
can kind of brush up on it a little bit.
Yeah.
Absolutely.
We should clean it up as far as the
Yeah.
status of it right now.
No, I agree.
Yeah, that's the
Totally
issue
agree.
right now, is the status.
Make that
Mm-hmm,
pretty clear that there's a moratorium and it's on.
No, I agree.
mm-hmm. Yeah, that's really the ask that we brought to the board today, was that, to clean it up. Just so we know what to be telling people, and we know what the state is going to tell people. So, okay. All right, well, do you have anything, Dr. Aiken, that you want to?
Nothing really that we haven't already talked about.
But how are we gonna recruit a new medical director? That's kind of a big deal.
It's very much a big deal.
Can you wait for a couple years for whenever Bobby wants to retire? By law, we're supposed to hire an MD, but we can
Doesn't have to be.
get exceptions and whatnot, to be the director of health, we can hire an MD
Mm-hmm.
to replace.
And I guarantee you, you better have more money to pay them.
We can probably at least afford another.
you were in the meeting where I discussed revenue projections, weren't you?
Yes, I mean, ideally, there are a handful of public health directors around the state that are physicians. But that's very few, and most of them are semi-retired physicians too, so, anyway, I mean, that, if you did that, you don't need a medical director, if you have a physician in the role as your public health director,
Can you still
so.
be a retired physician and still be a medical director?
Absolutely.
You can.
What are you talking about here then? Hey,
Because Dr. Aiken really wants to retire.
there is no such thing as retirement. Ask Bob Heil, he'll tell you.
You know, I never thought Bob was going to retire at all. And he is the most vocal advocate for retirement that I've ever met since he retired. So,
Don't ask Bob. Don't ask Rainer either, I know Rainer.
So your point is valid, John. I mean, well, it can be volunteer, but most of them aren't volunteer. I mean, but I will clarify that. It's not even, it doesn't,
He makes less
pay
than city
much
council
at all.
members, so
it's, yeah.
it's,
So it's really about basically having a desire to give back to the community, to work with all these community partners. And we have unfortunately had to call upon Dr. Aiken more in this past year in 2020 than we ever have any medical director in his history. So here in this county.
right. I mean, just to clarify from my perspective, there's a small stipend that has been given monthly to the medical director, and I've had this position from the early 1980s until 1995, and then picked it up again in about 2012 until now. And there's not a lot of responsibility that is generally involved. The last year and a half with COVID, of course, has been a great deal of time and effort spent in public health in Montezuma County. And yet, I think, from my perspective on it, this has been an extremely rewarding time to be the county health physician. That the partnerships that I've formed with you all, with so many agencies and people in the county who I've had the pleasure to work with in the last year in a way that I never did before, either as a physician in the community or as a county health physician. So, you know, and when we've interviewed this other person who has expressed some interest in taking my place, you know, we've pointed it out to that person that these relationships, the opportunity to become involved in many other portions of what goes on in our county and in our region, you know, is a big reward for the right person. So, yeah, I think that there's a lot to be said for that part of it. It's not about the stipend at all. It's really about being part of what's going on in our county and trying to contribute in some way to that.
Yeah, and I'm sure everyone knows Dr. Aiken's been wonderful throughout all of this, and he's done the research when none of us at the health department, when we're knee-deep in doo-doo, he'll do the research on the back end if we don't have time to look things up, and he's been nothing but very helpful. And he's communicated with cases, with school districts, with it goes all the way from beginning to end.
He's also
so.
been very instrumental in helping our other department heads as they've had questions come up
Absolutely.
in the last year and a half.
Yeah. So, you know, it definitely, I'm very grateful that he's been here, he's still here, hasn't left yet, but I support his decision to retire for sure, despite the fact that
I've seen what happened to Bob Heil when he retired. I mean, he fell down and had heart problems. And, I mean, I don't want to see that happen to Dr. Aiken. You're doing this for your own good.
Well, so anyway, so I don't think, your comment, John, I don't think we can put a moratorium on the medical director for the next couple of years until I retire. So,
We don't have a position as our.
Correct.
yeah, right. So anyway, when we have things more solid, I'll come to you and present, and then you can make a decision, okay? That's pretty much all I have right now, unless someone else has something else. Okay.
You know, maybe, I don't know who all you guys were considering or what people you had in mind for this position, but I wonder if the BOCC should be involved in that, you know. Obviously they make the final decision, but if you want to present to them, you don't have to do all that stuff in public on, hey, this is who we think might be good, this is who we're considering. In case there is a no, yes.
Mhm. And I mean, I would not be opposed to that as long as we went into like an executive session. Yeah, I mean, that would be fine if that's.
Executive
Mhm.
session, and maybe we get away with its day-to-day business ongoing.
Or however you want to do it, but I would not want to have,
Right. We
You
don't
know,
want to be like
right.
comments about people.
Right.
in public.
yes. So, that, you know, you guys can let me know what you want to do with that, and
But it is
we could do that.
Right,
Mhm. Yeah. Okay.
got it.
All right, and so our next meeting is scheduled for October 5th for our Board of Health meeting. And as always, if you think of something specific you would like us to go over or cover, let me know. Okay. Thank you, everybody.
Thank you. Dr. Aiken?
Thank you.
Thank you. And enjoy fishing, dancing.
Don't hang out with Lyle.
Well, he was
Well,
Lyle. He was
I know.
he was on the dance floor, wasn't he?
Yeah.
Oh, Bob Heil's on the dance floor.
Yeah.
That's right, yeah.
Yeah.
Yeah,
So maybe don't take up dancing, or
Ski.
yeah, definitely not, definitely not. And you're gonna have to put up with me till the end of the year, so,
yeah.
What was his last fishing? He was fishing. Dangerous. Stressful.
Well, thank you guys. I appreciate it. If that's all you have, we will adjourn this meeting.
Thank you very much.
You good with that? All right. Thank you, guys.